Greetings, Grizzlies. This is Mr. Hinthorn, your assistant principal for discipline and attendance, here with you during virtual advisory for a review lesson on our drug and alcohol policy here at McMinnville High School and for our school district. Think back to class meetings back in the fall, at the beginning of the school year. We reviewed a variety of important information, and our substance use and abuse policy was one of them. Just note, use or possession of drugs and or alcohol on school premises is not permitted and will result in immediate disciplinary action. First violation is a 5-day suspension and referral to family and youth for an intake meeting, as well as participation in a 10-week diversion program here at the high school Thursday afternoons for 90 minutes. If you're caught a second time or have a second violation in a 4-year period, it will result in a 5 to 10 day suspension with additional counseling sessions at family and youth. A third violation is an automatic 10-day suspension pending expulsion hearing to determine if you're allowed back on school for the rest of the year or not. And it should be noted that the sharing or selling of any form of alcohol or drugs on or near school grounds is considered distribution, which will result in an automatic 10-day suspension pending expulsion. Again, it doesn't matter if you sell or give or share alcohol or drugs with classmates. That is considered distribution and is actionable in terms of discipline. Now, that being said, we understand and recognize that the adolescent brain continues to grow and develop well beyond the 18, 19 years of age. And the brain develops from back to front. And we know that there's a lot of things going on in those teenage brains of yours, some of which is about school and others that is not. That being said, you have to remember that the prefrontal cortex, or the CEO of our brain, is the last part of the brain to develop. And with that are a lot of the highest mental functions. So using drugs or alcohol can really affect your brain development. Also, research shares that rapid changes in the dopamine-rich areas of the brain make teens vulnerable to the stimulation and addictive effects of drugs and alcohol. And alcohol use during the formative years of your adolescence is potentially devastating to your developing brain. And you can see here how I mentioned the brain develops from back to front. Your coordination and your vision, your memory and sensations and movement, those are things that develop early, but things like judgment are late to develop. So risk-taking behaviors and judgment are things that continue to develop well into the late teen years. In Mr. Saltmarsh's classroom, this poster is available for viewing, and it talks about the harmful effects on alcohol on the teenage body. You can see that blurred vision, slurred speech, bleeding throat, breathing may stop, addiction, potential stroke, stomach ulcers, muscle weakness, intestinal cancer, a whole bunch of things. Even osteoporosis, the weakening of the bones, can be affected by alcohol use in the teen years. Another poster found in our health rooms is the poster on marijuana and the harmful effects on the body. And you can see reduced motivation, paranoia and anxiety, sleepy eyes, dry mouth, throat cancer, lung cancer and disease, increased heart rate, increased appetite, increased blood pressure, weakened immune system. And for those guys out there, decreased sex drive and sperm count. And in women, irregular menstrual cycles. So the negative effects and harmful effects of marijuana and alcohol are profound. What we're seeing here at the high school, in terms of at the student center level and with our campus monitors, we're seeing marijuana in the form of buds and shake and joints. We're seeing pipes, bongs, and smoking devices. A lot of times in kids' backpacks or in their pockets. We're seeing marijuana edibles, the gummy bears, brownies, pot cookies, candies. We're seeing students using marijuana dab oils and bringing dabs to school. Dabs are smoked, it's highly concentrated, and it's hard to limit the intake levels. And we've seen students that have been sent into hallucinogenic states with the need to be hospitalized for multiple days because they have smoked too much marijuana dab oil and had no ability to figure out how much was too much. We're also seeing bottles or cans of beer, hard liquor, some odorless and others not. We're seeing pills, which are super dangerous, especially if they're not labeled or marked. And we're seeing also some hardcore drugs, which is very concerning. So far this school year, we've had over 25 violations of the drug and alcohol policy between September 5th and December 15th, which have resulted in 6 expulsions, 4 of them for distribution, and 2 for having their third offense. These incidences have occurred on campus during the school day, in the den, in bathrooms, in locker rooms. They've occurred at school functions like games and dances. They've occurred off campus in front of our neighbors' homes. And as I mentioned at the beginning of the year, our neighbors are watching. They're taking pictures. They're sending them to Officer Carver and myself as evidence that we can work from and use as we're investigating situations as well. And we've also had students caught smoking or drinking at local parks while skipping class. I tell you, we can't make this stuff up. You can see a long list of different scenarios here, from smoking pot before school and coming to school with paraphernalia and product in backpack and trying to attend class. We've seen students drinking with friends and coming to school activities after the school day is over and they're under the influence. We've seen students getting high with friends off campus during lunch and coming back for class. Bringing alcohol in Gatorade bottles and sharing it with friends, selling marijuana to students in the bathroom, selling gummy bears that are infused with marijuana, or bringing pot cookies to school and sharing those with friends, bringing alcohol in water bottles and passing around during lunch, bringing scales or drug paraphernalia and large bags of weed into school and keeping them in backpacks, selling pills to students while at school, skipping class, going to the park, getting high, and coming back to catch the bus, just to name a few. And I say we can't make this up. Also, important to know that the new law in Oregon as of January 1st, 2018, says that students must be, or in order to purchase cigarettes, chewing tobacco, vaping oils, you must be 21 years of age to be able to purchase those items, which is a change. It used to be 18. So none of that stuff is allowed on school grounds or in the school. So please take note to that as well. Additional information about the brain, the corpus callosum, the hippocampus, and the prefrontal cortex are all areas that can be affected when students are using alcohol or drugs. You can see pictures here of a 15-year-old male non-drinker, and then compare that to a heavy drinker and the different functions. Teens could not remember words like apple and football that they had learned 20 minutes prior when they had been drinking. Other devastating and long-term effects of teen drinking. One is the number one cause of adult alcoholism, and can be correlated with depression, distress, behavior problems, academic problems, substance use, delinquent behavior. And by young adulthood, early alcohol use is associated with employment problems, substance abuse, and violent or criminal behavior, none of which are things that we want any of you to be a part of. In this picture, section A, the brain of a normal elderly person is displayed. In section B, the brain of a person with Alzheimer's disease is displayed. And section C, the brain of a person with alcoholism. And please note how different the pictures in section C look, because brain cells do not regenerate. Ongoing alcohol use during the formative years of adolescence can permanently alter your neurological development. There's some websites out there that have additional information for you all if you're interested in checking those out. how to resist peer pressure, how to